Hello. So today we're going to go over the adrenal glands. So we're going to look at their function. We're going to look at certain adult pediatric abnormalities. So there's a number of key terms that we can go over. For example, anoxia is a lack of oxygen supply to the body, or an organ or a tissue. Adrenocorticotropic hormone is a hormone secreted by the anterior pituitary gland which controls the release of hormones by the adrenal glands. Congenital adrenal hyperplasia is a group of disorders where there's deficiency of cortisol production by the adrenal glands. Although other hormones produced by the adrenal glands may be deficient as well. Crus of the diaphragm is a tendinous structure that extends from the diaphragm to the vertebral column, and there are two crura, the right crus and the left crus. Gyrota fascia is a fibrous envelope of tissue that surrounds the kidney and the adrenal glands. Hirsutism is excessive hair growth in women in areas where hair growth is normally negligible. So what exactly are the adrenal glands? Well, the adrenal glands are paired, first and foremost, and they're controlled by hormones produced by the hypothalamus. And the adrenal glands subsequently are retroperitoneal endocrine glands. And neurophysiologically, they are controlled by the hormone-producing hypothalamus and subsequently by the anterior pituitary gland. And we call this feedback system the hypothalamic pituitary adrenal axis. The hypothalamus controls the release of adrenocorticotropic hormone, and adrenocorticotropic hormone is released by the anterior pituitary gland, which in turn controls the release of hormones by the adrenal glands. Each gland is composed of a medulla and a cortex. The adrenal cortex is the outer part of the adrenal gland, and it is composed of three zones. It is composed of the zona glomerulosa, zona fasciculata, and zona reticularis. And among the hormones produced by the cortex is aldosterone. Aldosterone is responsible for regulating blood pressure, and it does this by controlling the amounts of sodium and water in the body. The adrenal cortex also produces adrenergic hormones, and these play a part in the development of male characteristics as well as cortisol, and cortisol controls the body's use of fat, carbohydrates, and protein. The inner part of the adrenal glands, the medulla, produces epinephrine and norepinephrine, and epinephrine may also be referred to as adrenaline, and it is a primary hormone produced by the medulla. Both epinephrine and norepinephrine are responsible for the fight-or-flight response. Unlike the kidneys, the adrenal glands are enclosed in the Gyrota fascia. So just to go over the hormones produced, we have aldosterone, which regulates blood pressure. We have androgens, which have a minimal impact on the development of male characteristics. We have hydrocortisone, which plays a role in glucose metabolism, blood pressure regulation, and immune function. And these are all hormones of the adrenal cortex. The adrenal medulla produces epinephrine, and this accelerates the heart rate, and norepinephrine, and this also accelerates the heart rate and increases blood pressure. And so here you can see what separates the kidneys from the adrenal glands is the perinephric fat, and the adrenal glands sit atop the left and right kidneys. Vascular anatomy of the adrenal glands is as follows. The adrenal glands receive their blood by means of three arteries: the suprarenal branches of the inferior phrenic arteries, the suprarenal branches of the aorta, and the suprarenal branches of the renal arteries. Venous drainage is performed by means of the suprarenal veins, and the right suprarenal vein drains directly into the inferior vena cava. Sonographically, the normal adrenal glands are easily visualized in a fetus, and also in pediatric patients as hypoechoic structures that are anterior, medial, and superior to the upper pole of each kidney. So we can move on to some of the pathologies. There's Addison's disease, and this is referred to as the primary adrenocortical insufficiency, or chronic primary hypoadrenalism. It's an endocrine disorder that results from the hyperfunction of the adrenal cortex. It can be idiopathic, but it can also be caused by an autoimmune disorder, or something like tuberculosis. So with Addison's disease, the cortex inadequately secretes corticosteroids, and this results from partial or complete obstruction of the adrenal glands. Clinical findings include an increased production of ACTH, hypotension, weakness, and fatigue. Sonographically, in Addison's disease, we see enlarged adrenal glands during the acute stages of the disease, and we can see atrophic or calcified glands in the chronic stage. Cushing's syndrome can result from a tumor in the anterior pituitary gland, or a tumor in the adrenal gland itself. Now, cortisol, we had said, plays an important role in glucose metabolism, blood pressure regulation, immune function, and in the inflammatory response. So you can have a tumor that leads to the overproduction of cortisol by the adrenal glands, and the tumor causes patients to present with a number of ailments, such as a buffalo hump, obesity, a moon-shaped face, thinning arms and legs, poor wound healing, hypertension, red and purple striae over the abdomen and thighs, hirsutism, hyperglycemia, and severe fatigue. So sonographically, we see adrenal masses. Cone syndrome is primary hyperaldosteronism, results from high levels of aldosterone secretion by the adrenal cortex. Clinically, we see patients with hypertension, excessive thirst, excessive urination, high levels of sodium, low levels of potassium, muscle cramps, and sonographically, we see possible adrenal masses. Adrenal adenomas are the most common benign solid masses of the adrenal gland, and they can be either hyperfunctioning or non-hyperfunctioning. Hyperfunctioning adenoma is often seen in patients suffering from Cushing's syndrome or Cone syndrome. Sonographically, an adrenal adenoma will most likely appear as a solid hypoechoic mass in the area of the adrenal gland. So you can see a small focal bulge over there in the right adrenal gland. Pheochromocytoma. So the adrenal glands play an important role in blood pressure regulation via secreting various hormones. So pheochromocytoma will arise from the adrenal medulla, and it is typically hyperfunctioning. And the benign adrenal masses cause the adrenal gland to release excessive amounts of epinephrine and norepinephrine, thus leading to uncontrollable hypertension. Sonographically, we would see large hypoechoic masses in the area of the adrenal glands, and it can have various sonographic appearances, including hypoechoic or diffusely heterogeneous. And as we see here, pheochromocytoma is seen as a heterogeneous, between these two arrows, hypoechoic solid right adrenal mass. Adrenal cysts may be noted in the area of the adrenal gland and can be difficult to separate from the liver or the spleen. However, they can have a rim of calcification, and so sonographically there would be anechoic round with some acoustic enhancement and have a rim of calcification. So in this adrenal cyst here, it is noted within the right adrenal gland, and it has an echogenic rim, and it is anechoic and it is round, with some acoustic enhancement. Adrenal rests. So accessory adrenal gland tissue can be found within various body anatomical regions such as the epididymis, the ovaries, and the inguinal canal. Adrenal rests disseminate during embryological development and can form mass-like structures within the affected organs, and they are often associated with congenital adrenal hyperplasia. Adrenal carcinomas. Primary adrenal carcinomas, such as adenocarcinomas, are rare. Malignant adrenal tumors will often produce symptoms associated with Cushing syndrome, because they may be functional tumors that impact hormone production. So sonographically, we would see a solid hypoechoic mass and a large heterogeneous mass, one of the two. So we have an adrenal gland carcinoma, a solid irregular appearing mass is noted within the right adrenal gland. There it is extending into the inferior vena cava, so there is a mass extending into the IVC. Neuroblastomas are the most common extracranial solid malignant tumors in children. Most patients will present with palpable abdominal masses, abdominal pain, and bone pain. Sonographically, we'll see large heterogeneous masses located in the area of the adrenal gland. And so here we can see a neuroblastoma, and it's a solid mass, and it is heterogeneous, it is quite large, located in the area of the adrenal gland. Adrenal hemorrhage. The adrenal gland in stressed neonates or following traumatic birth can spontaneously hemorrhage, and this often results in a heterogeneous appearing mass in the area of the adrenal gland, and the resulting hematoma will be round or triangular shaped, as well as being echogenic, and over time it will become heterogeneous, hypoechoic, and cystic. So we can see an adrenal hemorrhage here in a premature 30-week gestation infant showing acute hemorrhage in the right adrenal gland, and the right kidney is compressed by the hemorrhage.